So today we're going to be doing a breathing practice or a pranayama that comes from the yoga tradition. And the one we'll be doing today is called Nadi Shodhana, or alternate nostril breathing. I have two people here with me today to help demonstrate. So I have Dr. Paidemarry, who is a family medicine resident, and I have Dr. Hirekatur, who is part of the integrative medicine department here at UW. So this practice is a calming breathing technique. It helps to increase the vagus tone, which is a big part of our parasympathetic nervous system, or as we like to know, our rest and digest. For folks that have anxiety, it can be really helpful. It can also help lower heart rate and blood pressure. But to note, if you already have a low blood pressure at baseline or low heart rate, to kind of take caution because it could further lower that. If the blood pressure is too low, it could also cause a little bit of lightheadedness as well. So something to note for. So I'll first demonstrate and do the breathing practice, and then we'll do it all together. So I typically use my right hand. You could do this with your left hand, but the thumb will go on the right nostril, and the ring finger will go on the left nostril, and you'll be alternating closing the nostrils between the inhalations and exhalations. So to begin, we always start with just a deep inhalation and a deep exhalation, and then we go into the technique. So we'll inhale and exhale, and then covering the right nostril, we'll inhale through the left, close the left, open the right, and exhale. Then inhaling through the right, close the right, open the left, and exhale. And you can do this for about 7 cycles and then take a break and then come back to it, whatever feels right to you. So why don't we all try it together?
Yeah.
So we'll do the collective inhale and exhale, and then we'll begin starting on that left side with the inhalation. So inhale and exhale. And then covering that right nostril, we'll inhale through the left, close the left nostril with the ring finger, open the right, and exhale. Inhale through the right, close the right, open the left, and exhale. Inhale through the left, exhale through the right. Maybe do 2 more cycles in your own time. How was that for you? Very calming.
Yes, it's very calming. So that kind of calmed myself down. I could feel my heart rate actually decreasing. And then, previously I did some heating pranayama, so I was buzzing and feeling hot. Now it's all calmed things down.
Great.
What if somebody has black nostril from allergies?
It can be uncomfortable maybe to do the practice, but actually in time it can help to open those pathways. Yes. So it can be really helpful when you have a cold.
Yes, actually that's not a deterrent.
Who shouldn't do this practice? Great question. As we briefly touched upon earlier, if you have low blood pressure kind of at baseline or low heart rate, doing this practice could further lower those two, and that could cause a little bit of lightheadedness. So if you start to notice that when you're doing the practice, I'd recommend discontinuing. But otherwise, pretty safe breathing practice because of that calming effect.
There are some studies behind this. Several studies show that it improves blood pressures and heart rate, and also the attention span in some people, mostly healthy people. It also improves the lung capacity, like functional vital capacity, FEV1, which is the volume that one can exhale in 1 minute, and peak expiratory flow rate. So these have some application in people with asthma and emphysema. And it also, the studies show that it improves attention and motor movements, fine motor movements. There was, it improves fine motor movements. It also improves heart rate variability. Most pranayamas improve heart rate variability. And there was one study that looked at several other studies. There was consensus that it improves blood pressures and heart rates. And there was one study that looked at people with migraine headaches. They noticed that a regular practice of meditation, who practiced daily for up to 3 months, they had decreased frequency of migraine headaches and also decreased intensity of their migraines. There's only one study, but again, it was a decent study with a good number of patients enrolled. So it also decreases anxiety. One study looked at anxiety, and then another study looked at patients with glaucoma, for intraocular blood pressure. They noticed improved glaucoma, intraocular blood pressure inside the eye. The blood pressure was improved. And also it can improve autonomic function, which is like sympathetic versus parasympathetic response.